All right, so I want to thank everyone for joining us today. I see we're already quite a few of us, so I think we can get started. Today we'll be talking about the Global Fund board meeting that took place earlier this month in Vietnam, as is tradition for some of the board meetings that are taking place outside of replenishment year. So Katie was there, fairly jet lagged, because it was a really long trip for her. And so we'll first hear her impressions and her thoughts on how the board meeting went, what were some of the key issues that were discussed, how they were addressed, etc. And then we'll hear from the three delegations in order: the developed country NGO, developing country NGO, and communities delegation, respectively. So, Katie, the floor is yours.
Thanks, Conte, and thanks for outing me in my jet lag. I was reviewing my notes before this call and found a sentence that was like, incomplete notes, basically asleep, awake, still sitting in the room. So anyways, but it was, it was a very interesting few days at the board meeting, a lot of interesting discussions, but also because we were, not in Geneva, the opportunity was taken for a number of different sort of side events highlighting work that had been taking place or was still taking place in Vietnam on the 3 diseases. There were some celebratory moments in terms of celebrating the key populations and the work that's being done in Vietnam. A very, I can't remember what it ended up being called, but a community gala, I think is the best way to describe it, that took place where we, met a number of colleagues from Vietnam who were doing work on 3 diseases and celebrated the work that key populations were doing. We had the opportunity, many of us anyways, to visit different sites and learn about the work that Global Fund funded colleagues are doing in Vietnam, primarily in the Hanoi area where the meeting took place. But the meeting itself, had 2 days of pre-meetings and then 2 days for the board itself, and covered sort of all of the usual things, such as a report from the executive director, discussion about what the committees would be focusing on, updates on resource mobilization and on various governance issues, but also it also had a very big discussion and a withdrawn, I think was the word used, decision point around pandemic prevention, preparedness, and response, because there had been a very late, in terms of the timeline for the board meeting, issue that had taken place with the World Bank Pandemic Fund, where the Global Fund was not going to be able to quite complement the work in the way that they had proposed as an implementing entity. So it wasn't going to, in this first round of the pandemic fund, the Global Fund will not be participating as an implementing entity. So there was a lot of discussion about that and how that came about and what could be done. I always find, unfortunately, this time there was not a written report from the executive director, but I always find those to be an interesting set of sessions and discussions, usually on the first day of the board meeting. And I just wanted to share, that the ED went through sort of the good and the bad around sort of the 3 diseases and RSSH in terms of, what progress was being made, but then the very real concerns around, infectious deaths and malaria that are moving the wrong way, and that there's malaria in particular seems to be facing a perfect storm at the moment with, climate change issues leading to a number of changes that are pushing the disease in the wrong direction. Of course, he also, went over sort of the organizational capacities. It is a board after all, so they do have sort of due diligence responsibilities, and talked a bit about, sort of the staffing and how they're adjusting to deliver on the new strategy, as well as the changes in the communities, race and gender sort of program and department. Significant changes being made there to help the department kind of hopefully flow better throughout the entire organization. But also Kate Thompson, who many of you would know, has announced that she is leaving in December this year. So an awful lot of things going on and changes happening. And then from my perspective, before I hand it over to the reps from the different delegations who are going to speak to us today, one of the interesting things, because of the timing of this board meeting, was that we got some very initial reflections from the technical review panel, the TRP, around the wave 1 applications that had been made. So we were able to get a little bit of information about about that because it had just kind of recently, within hours, I think, of when we had those sessions, they had finished their review and made their decisions. And I think that some of the key things that we heard about that was that, in wave 1 applications on HIV, they felt that they were seeing a better priority on prevention and targeting key populations, but that they were still seeing issues around whether or not the choices and prioritization were being driven as effectively as they needed or wanted by data, and that there remains a focus in those grants on commodities, but that there was, at least a lot more prevention commodities, approaches that were being suggested in those grants. On malaria, there was some very, I think the way the ED described it was, or perhaps it was one of the TRP chairs, but that there were extremely difficult trade-offs that countries were making in their applications and their first round of proposals. Around, trying to make sure that they could try and take advantage of new technology like the dual nets are way more effective, but of course they cost more still. So, and some concern around where malaria is going to be in the third year of some of the grants, as some countries are making a trade-off of investing only in sort of the first 2 years of the next 3-year cycle, and with no funding for malaria in the third. But it was important, I think, that that both the TRP and the ED mentioned that this is just the first iteration of the grants, and there's lots of conversations still to be had about trying to work with countries on that. But that was quite concerning. On TB, I think there was a lot of conversation and reflection around the momentum and the fact that early data from 2022 suggests that TB is bouncing back from COVID in terms of case detection and those kinds of things, and that there's some momentum right now, but that more momentum is needed, and the momentum needs to be sustained, not just sort of through the high level meeting, but in terms of continuing to show momentum on new technologies like diagnostics and therapeutics, and needing to find the resources to sustain that. And then on RSSH, and I think often, these comments are made in the context of how many donors have, suggested that RSSH investments are really critical to their investments in the Global Fund. But on RSSH, they definitely see that there's more sort of growth, especially in wave 1 anyways, alongside the C19 RM investments that are being extended through, I think it's the end of 2025 at least. But one of our colleagues can correct me if I'm wrong. And so, it should definitely be an increase in terms of RSSH expenditure over the next few years, but it's not clear yet in terms of whether it will be a huge increased share within the sort of core grant money. So I just thought I'd sort of share those reflections. I will post in the chat where you can look for documentation right now. I checked again this morning. The only thing that you can find there are the decision points that took place. And they were, sometimes these board meetings, the decision points aren't reflective of the richness, I think, of the conversation and the discussion and the variety of issues that are discussed. Because this time you can see the decision points look fairly anemic, I guess, in terms of, maybe previous meetings. But I will be working to finish up the short report that GFAN always does. There's a few out there already from colleagues that we'll point you to, but for today, we just wanted to hear from the delegations and hear their reflections on what some of the key issues were, how they're planning to continue, engaging and discussing these with their constituencies and with all of us as a broader, as a broader community. And then, so that's the purpose of today's call, as we usually do. And we have colleagues from both of the NGO delegations as well as the communities delegation joining us today. So I'm going to pass it over to Beatrice Stickers, who was attending the board meeting for the first time in her capacity for the developed country NGO delegation as the board member. So thank you, Beatrice, and once again, wonderful to work with you in this new capacity as a board member. Over to you.
Thank you very much, Katie. And yes, we were in the same meeting, but it was such a rich meeting. And my notes somewhat overlap with what you said. I'll try to pick out what the other observations that I had in there. So indeed, it was my first time in the capacity as a board member, and I must say it is a huge scope of matters that we talked about. For me, what came out as a general, so I'll just try to touch on a few points. In general, the mood the board meeting really took place against the background of not only the very worrying repressive laws and breaches of human rights and backlashes in that area, but also a great sensitivity of the global insecurity, conflict, inflation, tight fiscal circumstances in countries, in implementing countries, but also donor countries. What we found is that there was what really struck was a solid alignment across the board, implementers and donors, on the importance of the strategy and leave no one behind. And it started off with we always meet as an implementer group ahead of the board meeting. That means the 7 government delegations from across the world, as well as the 3 civil society delegations. And we were able to come with a joint statement on our concern on human rights and the critical importance of leaving no one behind and having solid programming to support human rights. That was, and the implementer statement also talked about the importance of having flexibilities in challenging operating environments, and of course, wanting to have the pandemic fund and the global fund collaborate closely. Indeed, we had the TRP report that was still on a pre-day. In addition to what Katie reports mentioned, one of the worries that came across was that a lot of program essentials and core program aspects are, because of the very tough trade-offs that need to be made, they are in the above allocation sections of the grant proposals. So, and there are really TRP flags financing gaps, especially in year 3 of the grant proposals as submitted. It does say that there were very positive steps in community health worker, community strengthening programs, but there are opportunities to do that more strongly. And let me then go, there was another side event, so that's on the TRP side meeting. There was a side event on challenging operating environments, in which especially the Western and Central African countries, but actually another number of other countries across the globe, pointed to pointed to that the additional safeguard policies, which are often imposed on countries, that they are not released quickly enough, and there's no road to that. One of the nice things is that the Secretariat immediately has now finally said that they will really take that seriously and try to find ways how countries can get out of that very restrictive policies. Then on going to the board meeting itself, the Executive Director report will become available in written form. That was a commitment made, so that we can join through the GFAN list when it becomes available. It's a really good read. Katie pointed to the content. One of the things that the ED also suggested for how to face all of these challenges, they said basically the Global Fund should really position itself and position global health much more strongly in the climate agenda, so that especially climate adaptation funding can also be accessed for global health. second positioning of the Global Fund to really continue to position the fight against HIV, TB, and malaria as the best way of increasing pandemic preparedness, or a very solid way of doing that. Then they also, the Global Fund will be really continuing to crowd in health financing from multilateral development banks and regional development banks, so that they can go to health financing. And then on human rights, that the Global Fund would speak out solidly. And as you all have seen, probably, is the statement that came out from UNAIDS, PEPFAR, and the Global Fund on the horrendous laws that are now passed in Uganda. As a delegation, what did we prioritize? We prioritize points on that greater transparency on co-financing, and that the co-financing to really look at improving, not necessarily increasing the quantity, but the quality of co-financing. Now, this resounded across the board, and we do expect that there will be attention in the committees or in the board for the remainder of the year, because it's really important that this will be addressed before all grants are, as grants are made, the co-financing commitments need to be better embedded and more transparently communicated. On CRG, so communities, rights, and gender, a lot of delegations in civil society, us included, are really, we're concerned about the capacity in the CRG department, but also see as a delegation who have pointed to the need to really make sure that CRG capacities are internalized in the grant management as a way to address capacity constraints. On the board also had a long discussion on the key performance indicators. Their new targets were set for the impact targets on addressing the disease. Addressing mortality, but especially incidence as well. Now, what has come out is that because of the bad and economic environment in the world, and because of the lack of a somewhat disappointing replenishment, the targets are set below what is needed to reach 2030 targets. However, the board felt that the targets needed to be set at a realistic level, and that it has to be used to point out that we're not on track, and that as a partnership, we really have to step up and increase the funding. Pandemic Fund, Katie completely covered. Another area that is, of course, receiving a lot of attention is the prevention of sexual exploitation, abuse, and harassment. And so there was a solid conversation on that in the ethics report and related and ORG report. What we pointed out as a delegation is that while we are expecting more reports, we also need to be mindful that we support strengthening the prevention, but also not get derailed in so that the processes must be nimble, so that people can also continue to concentrate on implementing while also seeking better protection in this area. I think those are the principal points I wanted to address, except for mentioning that we, as our delegation, but along with many other delegations, have really pressed on having a close look on incidence reduction, and that be closely monitored, not midterm, but on an ongoing basis. So I think that was a clear message that resounded across the board. Thank you.
Thank you, Beatrice, and congratulations again on finishing your first board meeting in that capacity. I think it's always, and now we get to go to Carolyn, who was doing this board meeting and as a final board meeting in her capacity as board member for the developing country NGO delegation. So there's always this coming and going of folks, but it's always great to see new faces and to continue to see those who've been engaged for a long time and leading us and our colleagues. So Carolyn, I don't know if you want to add on to what Beatrice had to say and let us know in terms of the developing country NGO delegation, what your priorities were to raise and to discuss during the last board meeting. Carolyn?
Thank you, Katie. Yeah, I think my colleagues, and I'm sure Javi will cover anything I missed, but our focus for the entire board meeting was on the threats to the Global Fund's ability to deliver its vision and mission, because we consider that these have deepened and multiplied in 2022, going into 2023, including increasing conflict situations, the harmful and punitive laws gaining momentum in several countries, increased incidence of HIV, TB, and malaria in some regions, and continued shrinkage of civil society space. All of those posing challenges to sustainability of the Global Fund's gains. And we centered, and we're happy to see centered at the implementer group meeting, the principle that communities are at the center of everything we do. And that is a quote from our new strategy. But we pointed out that this must move from rhetoric to action in order to address these threats. And so we read all of the delegation paper, all of the board papers with those points in mind. And so we looked, even when it came to things like risk, we had our comments on the malaria risk, on the TB risk, but we also commented on the fact that the risk report had the direction of travel of human rights risk as steady. And we questioned how this could possibly be, given the situation which has worsened since with the passage of the Uganda law. We pointed out for the Global Fund engagement with pandemic funds, as we pointed out over and over again, that the pandemic fund must ensure the engagement and opportunities for civil society in the pandemic funding. Beyond 2 seats on the board, it must go down to community level. We must have the community implementers. We must have community system strengthening as part of the way that the funds are disbursed for the pandemic fund. One slight correction, Katie, and forgive me, it's just that where I sit, I have maybe a little bit more, is that we haven't withdrawn as an implementing entity. The Global Fund has not withdrawn as an implementing entity. What it said was that the proposal it had put forward to integrate funding from the pandemic fund into the C19RM unfunded quality demand had to be withdrawn because the pandemic fund would not consider it. But it will remain eligible as a implementing entity. And there are 7 or 8 countries, and the number keeps shifting, that have cited the Global Fund as the implementing entity in their applications for funding at that pandemic fund. But I mean, as it became clear at our board meeting, the issues around the $3.4 billion of application the pandemic fund has received versus the 300 million they're dispersing makes it highly unlikely that most of the applications of that money will be funded. On the KPI framework, we did point out that the new strategy provides the Global Fund the opportunity to leverage its diplomatic voice. And we cited the need that this must be raised as we're going forward. I won't go into a lot about it, but we did, just to focus on the human rights report, we asked for continuous updates on implementing countries that criminalize key populations in order to have informed decision making, even on grant approvals. And that we needed to review the risk assessment, human rights and gender equality direction of travel. And that we needed to continue focusing on the key principles of the strategy, but ensuring the safety and security of key populations and continued access to services, including reprogramming of funds if that was needed to enable that. And that the Global Fund needed to enable community, civil society, and regional organizations, whether registered or not, to be better funded to support this work, including through dual track financing. That was the focus of our board interventions at every paper level, as much as we could focus there. Like you, I share the disappointment that the ED's report is not written. I think it should be written and provided to the same timeline as the other board papers. It's too important, too full of information to be simply delivered orally at the table and expect a reasonable response. Our delegation, just moving a little further away from the board meeting, I know this is a board meeting update, but since then events have moved and we are talking about the law has actually passed in Uganda that we were all fearful of. And we are not at this point in time particularly happy with the response from Global Fund UNAID, the joint response from Global Fund UNAID and PEPFAR. We don't see a lot that changes the landscape, and the Global Fund is in a position actually to be thinking about how to change the landscape for the people in Uganda who are at risk now. I'll hand over to you, back to you, Katie, and happy to answer any questions that we have time for.
Thank you so much, Carolyn. There are a couple of questions coming up in the chat if you had a chance to look at them, but also we can get back to those when we get to the discussion. And thanks for clarifying around my comments on the pandemic fund. You're absolutely right. It's not, gone as an implementing entity entirely. It is, however, not going to be a leading entity on its own in this first wave anyways. But the other thing about the pandemic fund I thought I'd just mention, because your comments reminded me of it, was there was a fair amount of discussion, both primarily not at the table, but in bilateral meetings around the pandemic fund, about how many of the donors sitting at the table are both donors to the Global Fund and the Pandemic Fund, and somehow seem to be surprised and disappointed about this development in terms of, the Global Fund not having its, standalone proposal kind of thing accepted, or not being able to do that. And I think some of the comments that I heard many from our delegations making to people in the corridors and in those meetings was, well, you're the donors. And if you're surprised by this, then that's sort of, you're sitting at the table. There's many more of you than there are of, sort of us sitting at those decision-making tables, even though we do have, 2 reps of the pandemic fund. So it was important to, just to remind those colleagues in donor countries that actually they have a responsibility on this as well. And it's not actually just all to fall back on the Global Fund, I think, to be honest. But, obviously there's more that the Global Fund needs to do. But anyway, so thank you for those comments and that clarification. And I'll pass it over to Javier, who is sort of somewhere in the middle of his term as the board member for the community's delegations. So welcome back, Javier, and thank you for joining us. Looking forward to hearing about what communities is currently focusing on and focused on during the board meeting. Thanks, over to you.
Thank you very much, and thank you, the GFAN team, for inviting us for this critical meeting. And let me start, as Katie mentioned in her brief, started by some of the things we hear from the Vietnamese local community. We also have the chance to bring some of the communities of people living with HIV, TB, and malaria, and also key populations from across the country to a pre-meeting with the community delegation, which of course has always been very important, a priority, and very inspiring. I think that what we hear from the Vietnamese community is that, of course, there are some challenges around engagement on TB, but also there are a strong requirement and urgent need to have TB screening tools. And of course, treatment is frequently interrupted because there is a copay requirement in Vietnam, and it's not the only country. That's why we highlight that. And of course, there is an approach in many health facilities of isolating people with TB, of course, in a hospital. And it's not only the ability to pay for the copay, but it's also during a month getting the chance to access to food and all the family disruption that have a catastrophic cost for our communities. Of course, Vietnam have a very strong HIV and malaria network working in there, but also there was a request from the local communities to need of the flexible funding to invest in the community system. As you might probably see if you read the community's delegation statement before the board meeting. One of our areas of work and advocacy, probably one of our obsessions, is to support the Global Fund partnership to find a way to channel some single stream of resources for key populations, HIV key populations, and people affected by TB and malaria, a community-focused funding. Moving into the board meeting, I think everyone was like having a long trip and probably already missing a bit of the Global Fund board meeting drama. But I do agree with the previous speaker that not necessarily being fixated with decision points and friendly and unfriendly amendments. We basically have the opportunity to have a deep discussions on some of the issues, and I think that it has been always very fruitful having the in-person meetings where we do have all these bilateral meetings. I want to highlight the work done by the implementers group leadership on pushing all of us to come together in a joint statement, but also that shows the dissociation, because I mean, the first thing we thought about the EMG joint statement is where some of the, let's say, African constituencies or even Eastern Europe constituencies maybe stand about some of the language on human rights and the current situation with criminalization. But sometimes people who sit in the Global Fund board might not probably be so engaged with the local politics, which is an advantage for having a joint statement, but not necessarily of how the Global Fund board could leverage some of the change needed at those countries where there is a lot of current issues on human rights. And that's probably linking to another priority for the community's delegation. We have some concerns around the key performance indicator. It's a E1, which is linked to human rights. And we believe that falls short in adequately reflecting on the ambitious strategy. And we have a discussion around that, and we will be following that. I mean, probably for people new in the call, we need to understand that some of the human rights investment are focusing in around 20 countries in the approach of breaking down barriers. But the major question is what happened with all the other countries which are not part of this initiative, and how we measure the performance of the Global Fund in improving and increasing the engagement on human rights, especially with the situation we are facing. And I mean, moving into the risk appetite that has been briefly mentioned by the people who speak first, we want to see some more risk appetite around investing on human rights and communities, and understanding risk appetite not as an irresponsible way to run the investment of the Global Fund, but take on some issues like human rights and gender. Sometimes we need to take some risks to make sure that communities are properly funded and also not only become the source of community health workers, but also remain as a community-led monitoring, watchdog, and advocacy work. And that in some way must become from the Global Fund investment, directly or indirectly. And of course, that is a risky business. Of course, another very important discussion that Katie, Caroline, and Beatrice mentioned was around human rights. It was important that the board and the donors community also speak about what the community delegation called the pandemic of hate, which one of the symptoms or the tip of the iceberg is what happening before and after the board meeting around Uganda criminalization of LGBTIQ communities. But we know that that's happening in Central America, that's happening in Eastern Europe as we speak. So we see that as emerging trend. And we believe that the Global Fund should become more proactive as a partnership. And we also even recommended a working group. I know it's not always a very friendly recommendation having a working group, but I think that the Global Fund needs to remain more vigilant around what the developments and the contagious how this hate and anti-rights approach, conservative approach, will be moving across the region and also transmitted to other regions. Of course, we welcome that the Global Fund leadership expressed their position recently after the board meeting. Sometimes maybe a bit late, but I mean, we should also acknowledge that at the Global Fund Secretariat, CRG team or department, etc., there has been a lot of things going on behind the scene. So that is also important to protect when the Global Fund board position themselves outside. We need to also not only protect the safety and well-being of LGBTIQ communities in those countries, but also protect the work that the Global Fund are doing behind the scenes as a diplomatic voice, together probably mostly with UNAIDS and other global networks. We echo the importance of having the ED report in written. So then as delegations, we could also address some of the issues in the statements, not only raising the placard in a long session where all the constituencies needs to react to the executive director report. Of course, to finalize another obsession, the pandemic fund. I totally echo what Caroline said, and Beatrice and Katie. We already, I'm coming to my 8 minutes, sorry, but we already starting communicating with the civil society constituencies in the pandemic fund, which is that's I think was proactively organized by my colleagues in the NGO delegations, and that is critical. And we have an initial conversation, but of course, this alignment and collaboration is very important. But also our main concern is how we engage communities and civil society at the country level. Of course, we may see the pandemic fund creating a lot of expectation with 170 countries requesting resources and probably with around 300 million still to be invested, and some issues around conflict of interest of some of the implementers entities, which are also hosting the pandemic fund, such as WHO and the World Bank. But we're looking forward to continue engagement. We clearly signal the Global Fund Secretariat to remain at the strategic level. Of course, it's always good to know that the Global Fund could become an implemented partner, but it's also important that we deliver on the allocation and investment on C19 There is money waiting to be implemented, probably more than what the pandemic fund could deliver in the first year. So I will stop there, and yeah, I basically also echo all the comments from the people who speak before me. Thank you.
Thanks so much, Javier. I'm sorry, I was just putting that in there for everybody to know that we were coming up to the Q&A to get their Q&A kind of brains on, and use the raise hand function if you do have a question to raise here, or just note in the chat that you have a question if you're having difficulty in terms of your connection today, or not in a place where you can ask a question orally. There were a few questions that were posted in the chat as we were talking, and I think that they fundamentally get to sort of the model and how the Global Fund provides guidance and advice versus direction in terms of the creation of applications and what the funds will be focused on. And they're both of these questions in the chat, and I'll come back to the three of you and see who would like to respond it, but just around, in particular, the inclusion of CRG and the inclusion of NGOs and CSOs more in terms of both funding, but also sort of being more actively engaged in the work that's being done in their country. So I'll come back to that. I did just also want to ask you if you can address in your questions or in the chat, if you have links. All of the delegations do state, well, not all of them, but most delegations, and R3 usually do statements sort of ahead of the board meeting so that they can, sort of notify colleagues at the board what their key issues are or what their, sort of key concerns are. If those are available publicly or will be, if you could share that with colleagues here and or put in the links as to where those could be found in the future. So that's sort of a question from me, but I'm not sure who might like to address the question around that were raised in the chat around the CRG and the approach that the Global Fund has in terms of providing advice and guidance versus direction. Could I call on Carolyn or Javier to address that? Thanks.
It's early morning in Jamaica, Katie, you know what I mean? And for Javi too. First of all, to Moazen, and forgive me if I've spelled your name, if I pronounce your name, Moazem Hossein. The TRP, the question of TRP recommendations and TRP comments back to countries came up in their report to on the pre-day, and a statistic came out about how much of their recommendations actually get followed, and there's to be some. This was quite a shocking statistic to us. To me, it was something I did not know, and it was addressed to Grant Management Division, because they're the ones that have to explain, you know, why what the TRP recommended wasn't taken on board. So the TRP can do their assessments, and they can recommend some changes to be made, and whether or not these changes are followed up then lies in the hands of the Grant Management Division. It became a talking point at the board from a number of constituencies. Was raised both at the pre-meeting and afterwards by some of the other constituencies. And so it's something that we will need to follow closely with the TRP to see, and also grant management, because to my memory, forgive me, it was a long and complex meeting. To my memory, the grant management did commit to providing some statement, some follow-up on this, but we certainly will need to take it on board to make sure that if the TRP recommends something, then really it should be included in the grant, you know, or there should be a good explanation why it isn't there. And I know that their focus, the TRP, is very strongly on communities and human rights. So, and making sure that these are included. We can expect to get a more formal report from the TRP later this year, and that will be helpful for all of our discussion. Hope I answered that question. Maybe I'll toss to somebody else if there's something.
Javier, did you have anything further to add, or Beatriz?
Yeah, I mean, I echo what Caroline says, and I think the Global Fund has the reputation of having a technical review panel which is independent and which using evidence-based intervention. So to be honest, to be blunt, sometimes implementers, governments, constituencies, and some donors say, oh, country ownership. For us, country ownership could also become anti-rights and continue buying 4x4 trucks instead of putting money into communities. So if you want the Global Fund money, you need to play by the rules, and the TRP is part of this structure. And as Caroline said, I totally support that the TRP is becoming more and more into health system strengthening, a resilient health system for health, CRG. I mean, the level of increasing the capacity, even at the level of the leadership, we should be really advocating for countries to take into, it's not direction, let's say feedback and conversation with the TRP, and grant management also need to be engaged and follow up on those recommendations. Thank you.
Thank you, Beatriz. Did you have anything to add, or if not, it's okay.
Well, just briefly, one of the problems that the TRP flags is that some of these interventions end up in the above allocation part, and we are not expecting that there will be a lot of portfolio optimization or money afterwards going to these interventions. So that's an issue. And there was a question from I believe somebody from Bangladesh, whether TB also has CRG requirements, and yes, indeed it does. And CRG elements are part of program essentials in TB, but again, TRP notes that sometimes these issues simply don't get sufficient funding. So that is an issue we need to keep on pressing on, as well as transparency on the uptake on TRP recommendations.
Okay, thank you. I think that the TRP report, when it does come out, is usually like one of the best reads around. It's also usually very long and comes sometimes a bit too late in terms of the context of the original grant applications. You use the term above allocation basis, so I just tried to clarify for any colleagues who didn't know what that meant in the chat, what that is. But if you guys have a better definition of it, please add it in there. But essentially, I believe it just refers to technically sound, reviewed parts of the grant proposal, but that just don't get funded, at least not initially with the initial country allocation. So please do correct me if I'm incorrect on that. And thank you to the communities and developing country NGO delegations who have popped their statement from the board meeting into the chat, links to them. So, and we have a hand raised from Robin. So Robin, I'll pass it over to you.
Thanks so much, Katie. And team, thank you so much for these really, really helpful debriefs. Yeah, it's been a very rich report back. So thank you very much for that. I think just building off of what's been said around the TRP, fully agree that it's one of the most important documents to read. So really looking forward to seeing that. I guess my question is around set-asides, and it comes from, I'm just curious whether or not there was any discussion about how to coordinate those set-asides or how they were going to be prioritized, because going into the window 1 and window 2, and actually also window 3, which is in August, there has been significant and really important technical assistance that's been provided to communities to help engage in the funding request development process. And that's been critical. So in most cases so far, we have seen an increase in meaningful engagement of communities in the funding request development process. It's not generalizable, but there has been in many countries significant increase. Now that the funding requests are, in window 1, TRP comments have just come back. It's going to be really important that advocacy and technical support remains available for communities to engage in this critical moment of grant making. And so, as far as I understand, there isn't a plan on how to make sure that technical assistance is funded for communities to be able to engage in that process. So I was just curious at the board table or in any of the side meetings or bilaterals, whether or not there was a discussion about how to make best use of set-asides so that it is actually going to mean something for communities in these really important processes moving forward. Thanks.
Thanks, Robin. It's a very good question. And of course, about a month before this board meeting, there was an announcement from the French government around part of their set aside being utilized to fund the Stop TB partnership challenge facility for civil society, as well as, kind of upping the French content, I think is the way I would describe the other pocket of money for the Stop TB partnership to make sure that there was more engagement of Francophone colleagues. But that was, like, to me personally, an example of a good and very public and transparent use of a set-aside, or a very small portion of a set-aside, because the France set-aside did increase quite significantly in terms of being directly relevant to the work of the Global Fund and the 3 diseases. But Javier, you've got your hand raised, so I'll let you address more. I wanted to raise that one because I'm not actually sure if the public announcement of that has been made, but it was announced at the Stop TB board. And so people had been talking about that as an example of a good use. So Javier, over to you, sorry.
Yeah, thank you for the question, Robin, and the clarification, Katie. I think the set aside, I could probably said that in all the bilaterals meeting with the 3 civil society delegations, the set aside with relevant donors such as the French, it was one of the priorities, which might probably was mentioned by France and others on the board table, but has been the focus of the bilaterals. It's an important to announce, since you mentioned the French initiative, the leadership or the people in the French government already invited to communities delegation members who speak French, and they belongs to the priority countries of this initiative to serve. So the communities delegation will be putting forward the names of 2 communities members who are from the countries. And so, I mean, there is the vision of engaging into the communities. We will see how that's evolved, but I think this is quite interesting, and we should take advantage of all these spaces. Thank you.
Yeah, and
Just, Katie, if I can, there was a paper brought to the strategy committee at this March board meeting with an overview of how the set-asides are being coordinated, what work is going on in the Global Fund Secretariat. And there's a significant amount of work and meetings trying to coordinate to make sure that the set-asides are used with the Global Fund, because they're set aside for that type of work, and coordinated and not duplicated and overlapping. So geographic coordination, technical coordination. So there is a lot of work going on that, in that area in the Global Fund Secretariat. And it's not only France, the largest group of set-asides is actually the US, and a number of other countries. So glad to see that work is ongoing, and we can keep that update going as well.
yeah, I was just looking through the board. I was thinking it was the board in November that had that report, but it was the committee meeting, and those documents are not public, I don't believe, yet until they make their way into a board paper. So I don't think we can share that with you, but it was an interesting paper that did assess sort of the level of sort of conversation that the Secretariat is trying to have around sort of those set-asides. I did just want to note that we do have Cecilia Sinu, who's also on the call, and was the incoming board member for the Developing Country NGO delegation, and I think has some more perspectives maybe to share around CCMs and that conversation that we started here today. So Cecilia, would I be able to call on you?
Yes, thank you very much. Hi, everybody. Maybe just to add to what has been discussed, our delegation also had a number of asks or made some requests to the board concerning CCMs. One of our observations is how some CCMs use conflict of interest to exclude communities and civil societies who are SRs from the CCM, which is not very good. Meanwhile, if government is a PR, government is not actually excluded. It's a big worry. We also requested that countries that are piloting ethics officer, there are a number of CCMs that now have ethics officers, and requesting that the Global Fund Secretariat should ensure that these ethics officers are very independent. They report directly to the ethics officer in Geneva to ensure their independence in decision-making. And also the CCM should be informed about the role of the ethics officer so that she's not isolated, people don't fight her, and she has a free way of working and addressing conflict of interest issues and integrity issues on behalf of the Global Fund in country, which is very dear to our delegation, the Developing Country NGO delegations. And thank you very much for the opportunity. Thank you, Caroline, everybody here present.
So pleased that we'll be able to have Cecilia reporting back at the next one. So happy to have her coming in as board member. So
thank you.
Just to follow, there will be a CCM discussion based on the OIG report coming to the SC in July. So we'll have more to report back from there.
That's great. Thank you, Carolyn. There was a question that I don't think we've necessarily addressed in the chat around specifically health workers and systems in terms of being underrepresented in decision-making, particularly with no defined sort of role in CCMs necessarily. So perhaps that's a comment that you could take forward into your deliberations. I mean, I know you have a different role in the strategy committee, but there are colleagues here who do represent communities developing and developed country delegations there. So maybe we can take that forward, David, and I'm sure folks know how to reach you for your work around the health workforce. So we are running out of time. So I did just kind of want to say thank you to our speakers. I know Conte has a few wrap-up notes for us today to make sure you're aware of a few things that are coming up soon, but just thank you to the three of you, to Cecilia, and to all the colleagues who joined today for this. As more information is available around the board meeting, we'll share that with you through the listserv on our website and so on. So Conte, back to you.
Thank you so much, Katie. And so I'm putting in the chat a few resources that we're putting out today and this week. We haven't talked about it on the call today, but as you know, the multi-stakeholder hearings took place the multi-stakeholder hearing for the tuberculosis, the HLM on the high-level meetings on tuberculosis, on the universal health coverage, and on pandemic prevention, preparedness, and response. Took place at the same time as the board meeting. We just put out a blog summarizing our experience attending the multi-stakeholder hearing. If you want to take a look, tomorrow we, as the civil society engagement hub for the TBHLM, we have a deep dive call coming up. So please register using the link that I've put in, and I'll be sending a calendar invitation and a reminder to the listserv soon. And we also put out again related to the high level meeting, we've put out an open letter to the President of the General Assembly to facilitate the registration process to the high level meeting in September. So it's live, and you can support the letter by clicking the link again. This is it for our announcements. I hope to see many of you on the TBHLM deep dive call tomorrow, if that's of any interest to you and your work. And I wish everyone a great rest of your day, beginning of your day, end of your day, depending on where you are, and see you all very soon.
Thanks, everyone.
Bye.
Thanks, everyone.
Thanks, everybody. Take
Bye.
care.
Thank you. Bye.
Thank you. Bye.
Bye.